The UK medicines regulator has approved the Oxford-AstraZeneca coronavirus vaccine. Along with the Pfizer vaccine that's already been given the green light, it paves the way for millions more people to be immunised in the new year. The UK government has ordered 100 million doses. That's enough to vaccinate 50 million people. The Oxford vaccine is much easier to transport and store than the Pfizer-BioNTech one already in use. It can be kept in a standard fridge and is also much cheaper at less than £3 a dose. The approval of the vaccine comes as the number of deaths from the coronavirus reported in the last 24 hours approached 1,000. Our medical editor, Fergus Walsh, has the details.
The approval of the Oxford-AstraZeneca vaccine, which is a fantastic achievement for British science.
It's a great day. We're very proud.
This is a really significant moment in the fight against this pandemic.
It is, I think, a game-changing moment.
This is the vaccine, more than any other, that will eventually bring coronavirus under control. Unlike Pfizer's, which needs ultra-low temperatures, the Oxford-AstraZeneca vaccine can be transported in a fridge, meaning every care home in the UK should now be in reach. The medicines regulator said no corners had been cut.
With this approval of the second vaccine, we are another step closer in helping to defeat this virus. Our clear message is that you can have every confidence in the safety, in the effectiveness and in the quality of COVID-19 vaccine AstraZeneca.
The vaccine uses a gene from the spike-shaped protein on the surface of coronavirus. This is put inside a modified harmless virus. The vaccine instructs human cells to make the spike protein, which prompts the immune system to create antibodies, which can recognise and destroy coronavirus. And it stimulates T cells, which should destroy cells that have become infected. So just how effective is the vaccine? The latest estimate is it gives 70% protection against COVID 3 weeks after the first dose. The NHS will now hold back giving the second dose of all COVID vaccines until 12 weeks, so more people can get protected.
The most pragmatic thing to do is to give as many at-risk people as possible the first dose of the vaccine, because we know that from 3 weeks after that first dose, there's a very good level of protection, and nobody in the clinical trials at that point after their first dose was in hospital with COVID or experienced severe disease.
This is now a race between the vaccine and the virus. That means getting millions of doses approved quickly.
We're going to ship 500 or a bit more than 500,000 doses this week to start being used on Monday. And then from there, we will rapidly escalate the deliveries. So I really think by the end of March, we will be in a very different place.
What many want to know is, when will they get immunised? Prime Minister, how many people will the NHS immunise every week? Because surely it needs to be in the millions.
The best answer I can give at the moment is that we will have millions of doses, tens of millions of doses by the end of March. We're working to get the programme going as fast as we can. I don't want to give you specific numbers at the moment.
Much of the production is done in the UK, like here in Oxford, unlike the more expensive Pfizer jab, which is produced in Belgium.
There are manufacturing facilities like this all over the world which are producing bulk quantities of the Oxford-AstraZeneca vaccine. The aim is to have 3 billion doses of the vaccine by the end of 2021.
To deliver a safe and effective COVID vaccine in less than a year is a stunning achievement. The challenge now to ensure rapid rollout to those who need it most.
And Fergus is with me now. Fergus, we now have 2 vaccines at our disposal. How significant an achievement is that?
I think it's hugely important and positive news, George. I mean, this vaccine can be used anywhere that has a fridge. It's as simple as that. And that's going to make it vital in controlling the pandemic here in towns and villages, but also across the world. Oxford always wanted to produce a global vaccine, and AstraZeneca has promised in perpetuity to provide this vaccine at cost to low and middle income countries. And it's only if we protect the world's population that this pandemic will truly be over. There are lots of different numbers flying around about how effective this vaccine is, but I think the key message is that even one dose should protect people from severe COVID infection and prevent them needing to go into hospital, which will be vitally important at the moment.
When do you think we'll see a difference in our daily lives?
Well, every person who is immunised is another small victory against the virus, but it's not going to make a major impact for months. There are around 25 million people in the priority groups. That includes over 65s, frontline healthcare workers, people with underlying conditions. Now, we need to immunise 2 million of those a week, every week until Easter, to make a real impact there. And that would just be one dose each, so a huge task.
All right, Fergus, thanks very much. Thank you.